The concept that we've learned, and of course we all know, is that you can build it, but they may not always come. Because there is treatment does not mean people will be engaged or that they will be successfully retained. So the element we want to highlight today is addressing barriers to engagement in treatment and then also retaining people in treatment. Again, one of the concepts, the social determinants or social drivers of health, has been widely researched and being highlighted in our work here today and ongoing in future research. Because things like, as you see, housing, homelessness, impacting the way that people are engaged in care, employment opportunities, and impacting the retention in care as well. Education levels and income stability, of course, impacting whether one can feel they can stay in care or will be engaged in care or motivated to be in care. And of course, retention, so that if someone does not have a roof over their head with shelter, how can I think about treatment or stay in treatment? And on the next slide, you'll see another framework which really does highlight other aspects of resources, both internal and external, that can be engaged to support someone in their journey toward recovery. The Recovery Capital Framework, which highlights the range of resources one may have, both internal, whether it be motivation, just coping skills, the confidence that comes in self-efficacy, one's belief that they can do it or they can bounce back from adversity. The external resources, again, we are not all given the same resources from the beginning, but those family and social network support, the group support, again, as I mentioned, housing, but even access to emergency rooms and primary care have been seen in an index that we developed as part of the Healing Community Study to show that fatalities were associated directly with the access to an emergency room, primary care, insurance, and housing. Again, this particular quote, a person who uses drugs saying, housing is the biggest health risk of anyone who uses drugs, and it affects everything in their lives. So as we think about this and you're developing your strategies and you take the ORCA menu that we're providing today and you begin to tailor your strategies to the local context in which you're working, making sure you're addressing these particular barriers, identifying and listening to the people who use drugs themselves about what they think is the best avenue of engagement and retention and how we can address those along the way. A very important concept is the disparities that exist of race and ethnicity when it comes to the overdose risk and death. As you see in this particular data, we continue to see the escalation of fatalities among those people of color, the non-Hispanic Native American, non-Hispanic Black men are 7 times greater than older white men of experiencing overdose deaths. And so our strategies must always be thinking about what are the barriers to engagement, what are communities of color saying about their needs and gaps of resources, really engaging them and elevating their voices in the community, as we have done specifically in the Communities That Heal intervention. You'll see the whole menu of options that I hope that you take advantage of the practice guide. So you see all the opportunities to address barriers when it comes to promoting both menu 1 and 2, as we've discussed today, by addressing things like childcare, shelter, access to primary care, housing, and then recovery support, especially driven by peer supports. We know those are so effective, making sure that peers are funded well, that their voices are heard and listened to, and that they're supported in their work and valued throughout the process.